Good day, my dear students. Welcome to R.A.T.S in Pathology for postgraduates. The topic for the day is macrophages in health and disease. Whenever such topics are given to us, most important will be the subheadings. Think of the subheadings. The subheadings will take you to the answer. Here I have given two lists. You people can prepare your own, but I feel that this is logical. On one side, I have mentioned the usual subheadings regarding the history, morphology, functions, defects, etc. And on the other side, it can be organ-wise or system-wise. What are all the pathological processes it is associated with, or the systemic diseases? And finally, is there any marker that can be used for the diagnosis? This kind of organization will help us present an answer par excellence, because it carries 20 marks, the time limit is 30 marks, and any student cannot write everything. This is an age-old diagram, very fundamental. I will not be going into the details of it, but there is a purpose. Kindly appreciate the length of the pseudopods, the engulfment of the organism, and what are all the various steps and the organelles involved in it. We shall be talking about the cells, the variants, the process of phagocytosis. You people are supposed to read up, go to Robbins. The receptors, the mediators, and the defects. We shall, however, remember for the time being the C3 and the FC receptors, which are there on the surface of the cell. And C3b can be an opsonin, which is coating the organism. Look at this over here, a beautiful structure from Odessa, Ukraine, Russia. But today, it has been reduced to rubles. Why am I going so way off the context? There is a reason. Look at this gentleman over here. He is none other than Mechnikov. Those years, you find that many a contribution had come into medicine from Russia and the Allied countries. And he was preceded by a pathologist, R.A.T.S. Slavjensky. I hope I am a little correct in the pronunciation. And along with Paul Ehrlich, he won the Nobel Prize. And until today, these names have stood the test of time. Whenever we talk about macrophages, please remember two things. There are circulating monocytes, which when go into the tissue can be converted into a macrophage. Two, there are certain macrophages which develop and reside in the tissue itself. This is a fundamental that we should be remembering. I shall be going to this detail later on. And also, having mentioned phagocytosis, there is a chemotaxis and the Boyden millipore filter technique, which is none other than this, designed by Boyden to show the unidirectional movement of a cell towards an attractant, which is chemotaxis. It is nothing but a simple filter with the cells in one compartment and the attractant in another. After some time, he found that most of the cells, in fact, all of the cells have moved to the second chamber, and that is the Boyden's millipore chamber, which has been very useful in the demonstration of the chemotaxis and later on phagocytosis. There is another movement called the Brownian movement, which is a random purposeless movement. These two should be distinguished, more of a property of microbiology, but since I could recall, I am presenting it to you. This again is a very conventional diagram. We shall touch upon it. There is a vesicle or a depression that develops when the pathogen touches it. And there are the edges which fuse together to form the phagosome. The phagosome in turn merges with the lysosome to form the phagolysosome. Ultimately, powerful enzymes are being poured into it and they digest the organism. It can also happen in the case of an autophagy and the residual body is ultimately formed. These residual bodies remain in the cell in the form of a lipofuscin pigment. So all these are things that people should have at your fingertips, but unfortunately we are more bothered about the WHO classification and the molecular basis of the tumors, etc. These things we do not answer. More than 25% of your paper rests on this. Now, what is the importance over here? These are our three guests: Salmonella typhi, Mycobacterium tuberculosis, and Mycobacterium leprey. Salmonella typhi is quite a weak organism, but it is very indigenous. In order to protect itself, it coats itself with receptors so that it can be engulfed by the phagocyte. And once it is inside, it is a kind of a symbiotic relationship. The macrophage and the Salmonella typhi survive together, only at the cost of us. Mycobacterium tuberculosis, he is another fellow who has got a brilliant idea. So far, so good. A phagosome is formed, the bacteria is inside, but then it prevents the fusion of the lysosome with the phagosome, so there is no digestion of the mycobacteria. So long as you are there, I shall live within you. That is the principle. And almost the same in the case of Mycobacterium leprey. These things you people should have in mind. What are the defects in phagocytosis? It can be diabetes mellitus, it can be Shadiac-Higashi syndrome, it can be the administration of steroids, or any of the infectious diseases mentioned over here. Kindly go back and recollect, because phagocytosis by itself is a question for us to address. And once we mentioned that, there is always an oxygen-dependent mechanism, oxygen-independent mechanism, which again you people should read. Just for a completion, you find that the myeloperoxidase and the halide and the oxygen radical, these all have an unpaired electron in the outermost orbit. Because of this unpaired electron, there is an imbalance between the proton, neutron, and the electron. As a result of which, they got powerful destructive activity. This is the same principle in the atom bomb also. So they can lead to destruction of the organism by pouring in their enzymes, which is quite important. Also, they can damage the cell, and this is being somewhat removed by means of the other enzymes such as superoxide dismutase. I would like you people to kindly go back to your text and read these topics well. Now coming to the macrophages, the terms will be: the Greek word macros means large and phage means to eat. Pinocytosis is to drink. Now, this fellow, the macrophage, is associated with the immune system also. It can be innate, that is, it is present since birth, or it can be adaptive and formed during the process of development. It is associated with phagocytosis, already seen. It can recruit lymphocytes, as in the case of a granuloma. There can be a dysfunction in the formation of a granuloma. In fact, granuloma itself is supposed to be a defective function of the macrophage. Size-wise, you find that it is more than 20 microns in size, and you will have to differentiate it from the other cells. It has got a long-term survival, several months or years. That is why you find that the organisms are able to survive. But the neutrophils, on the other hand, they have got just 1 or 2 days of survival. So these form the second and a more longer term of resistance and protection. This is our friend, the flow cytometer, used for measuring the size as well as the density of the granules. Odessa, Ukraine, Russia. Beautiful building that I'm seeing, the fountains. Looks like an era of peace, but not now. It has been devastated and there is a war that is going on. Why am I going so much out of the context? Not much. So, as far as the macrophages are concerned, there are two types basically. One is the inflammatory, the other is anti-inflammatory. Inflammatory is M1, anti-inflammatory is M2. This dichotomy or friendship is supposed to be questionable. Is it the same cell that is performing dual function, or is it two cells from the same lineage that are performing different functions? To add to the confusion, there is a third one called MREX, which means regulatory. So there are basically three types of macrophages which you people should remember: M1, M2, and MREX. All these can be studied with the help of a flow cytometer. Secondly, immunohistochemistry. These two parameters just remember. And when we say immunohistochemistry, obviously there should be a panel of markers, some of which I have given over here. These you shall remember to the best of your ability. Not possible to remember everything. Have it. At the other end, I find that M1 is useful in the conversion of arginine to nitrous oxide, whereas M2 is associated with ornithine metabolism. So these are certain things that we will have in mind. It gives us some kind of an idea about the macrophage. Now, look at this table very carefully. There are three columns. I had given the types of macrophages, the tissue where it originates from, and what the functions are. There are a list of these macrophages which you people already know. So do not get confused or anything. You can just like that recollect. Osteoclast, all of you know. Microglial cells, you people know. Alveolar macrophages, sinus histiocytes, Kupffer cells. All the things you people know. And obviously the tissue from where it originates. So these two are not difficult. The third one is you find that the macrophage is a very, very clever cell. It is associated with so much of the functions. And it is not that one particular type of macrophage does or carries out a particular function. There is a crisscrossing and multiple activities can be carried out simultaneously, up to scavenging. At the same time, the macrophages can be defective and there is something called as dysregulation, which we shall be touching upon. So, regarding the mononuclear phagocytic system, there is an endothelial damage, extravasation, chemotaxis, liberation of the cytokines, chronic inflammation, and scavenge. This is just for a recapitulation. This again is very clever. You find that this is a dendritic cell, again a macrophage, a cutaneous macrophage. What happens is when it gets activated, there is the major histocompatibility system that also gets activated. This then leads to the activation of the second line, which can be the CD4 helper cells or the CD8 cytotoxic cells. That is why you have a second line or the lymphocytes which come into play. This has been summarized in this. You people can just go through it. There is a macrophage, it presents the antigen. This is used by the immune system and then it is presented to the corresponding helper cells and it is integrated into the cell membrane. Therefore, it activates the major histocompatibility complexes and you find that there is a total symbiosis or a unison between these three. So this is a beautiful diagram which you people can draw. So also this. So this is from hypersensitivity, your Robbins gives, any of the book gives it, how a granuloma is formed. The basic principle is three things. One, there is a chemotaxis. Therefore, it moves towards it. After chemotaxis, there is stasis. It does not move away from the site. And the third one is there is a mitosis. When all the three things combine, you find that more cells come to that region, stay in that region, multiply, as a result of which you get a localized collection or an aggregation of the macrophages which forms the granuloma. So this is very simple. You people are all versatile with it. Look at this diagram. There is a granuloma that has been formed, but here these are all the various other cells with which it is associated. A macrophage, epithelioid cell, which is nothing but a modified macrophage, more of secretory function, less of phagocytic function. The bacteria, necrosis, dendritic cell, which we have seen, the lymphocytes, NK cells, neutrophil, eosinophil, mast cells. Now again, what can be the various causes for the granuloma? This is an age-old question. In fact, I would advise you people to go to one of the first chapters in Robbins wherein he mentions the granuloma and the causes for it. What is the necrotizing, non-necrotizing, etc. This is again a very useful table just for recapitulation, you people. You all know these conditions. But then it can be a foreign body, it can be necrotizing, it can be immune, it can be autoimmune, it can be non-necrotizing, as in a case of sarcoidosis or Crohn, toxic berylliosis, drug BCG, suppurative in the case of LGB, and histiocytic Mycobacterium leprey. Others are xanthogranuloma and Prostate-Dorfman. So this is a very beautiful one. What happens is the granuloma itself, they say, is a defect in the phagocytosis, a defect in the function. So these things we will have in mind. From now onwards, I shall be covering a few diseases here and there wherein we have got the macrophages. This is our Whipple's disease, identified by means of the columnar epithelium, the goblet cells, the intestine. But then the lamina propria is filled with sheets of these foamy macrophages. In fact, the villi are all bloated as though something is covering the entire mucosa, and Robbins again describes it as a bare skin rug appearance, classical of Whipple's disease, which is a malabsorption syndrome. And they say it is an infective etiology in it yet to be proven. Here again is the foamy macrophage. The gastric xanthoma is another one. These are the foveolar epithelial cells. And in the stomach, I find that there are sheets of cells almost similar to this, which is a gastric xanthoma. I hope you people are able to identify it. There are concentric circles. Only thing is, it is an electron microscopic picture. The zebra body is classical of Tay-Sachs disease. And I hope you people will be able to appreciate the similarity between these, which are nothing but defective lysosomes. This is our famous Mycobacterium leprey in a case of lepromatous leprosy, wherein you find the virtuous cells and the globi. These are being stained by the various stains, courtesy Dr. Sampura Roy. I would like you people to kindly appreciate this one, go to the various stains for leprosy. This one we have already seen, and this is the classical granule. You find that there is a giant cell and the epithelioid cell. The epithelioid cell is nothing but a modified macrophage in which there is less of phagocytic activity, more of secretory activity. And as mentioned earlier, it is causing an attraction of the lymphocytes. That is why you get a covering of the lymphocytes in a granule. This, of course, you people will be able to identify the flower shape inclusion, the asteroid and the Sherman bodies in a case of sarcoidosis. Kupffer cell is another cell, natural, and not much study has been done on the Kupffer cells because it could not be cultured in vitro. As a result of which, most of the studies are only what they have observed within the tissues. And this is a xanthogranuloma wherein you have got forms of this, maybe some cholesterol crystals here. The central nervous system, I have purposely chosen this one because of a good article that I came across. Here the macrophages can form cells of the immune system. They can be tissue resident or circulating. As I mentioned earlier, they can be infiltrating. They also form the first line of defense, regulate the immune response, and also cause certain diseases such as multiple sclerosis or glioma. Crosstalk is this. So you find that too many people are talking and then nobody is listening. Similar to a classroom. And this is one. So you find this particular diagram, I would like you people to kindly pay your attention and revise, draw. There are two important things. One is TRM and other is MOM. TRM is tissue resident memory T cells. And from this, you find that there is a kind of an understanding between the other cells such as the endothelial cells and the epithelial cells. And it can lead to the activation of the clearance of the various things such as toxins, phospholipids, etc. Helps in homeostasis. It can get converted into the macrophage. The second one is monocyte derived. So this is the bone marrow from which we are getting the monocyte. This monocyte derived macrophage can also be there. And here you find they carry out similar functions. Once within it, you find that there can be similar functions carried out by the tissue macrophage as well as monocyte derived macrophage over here. And these are the activities. But sometimes you find there can be dysregulation in all this. So this is another very important diagram which you people can do. So there are two things over here. One is a peripheral or a monocyte derived macrophage. And here it's a microglial cell that is leading to CNS microglia or the macrophage. These can be identified by means of a panel of markers or molecular substances. And this is very important list, whichever you people are comfortable with, I would like you to memorize so that you can definitely score in your answers. So this is a very important diagram to show the CNS component of the microglia and the macrophages. Multiple sclerosis is a disease, otherwise called as encephalomyelitis disseminator, in which there is a destruction of the myelin sheath. So here I find that there is a destruction of the parenchyma and part of it is being destroyed by means of an immune reaction. It is more of an immunological disease. And thanks to this particular person, it has been from Wikipedia and he is acknowledged. CD68 is used to demonstrate the various macrophages in the region of activity. Dysregulation can lead to CNS disorders or it can result in a tumor. So these are all the various things. What is the cause for dysregulation? They are actually resident cells, but you find that there is a kind of a misunderstanding between the infiltrating macrophages and the tissue macrophages. Myeloid cells also can be developing. There can be a misdevelopment in this. Sometimes the fetal liver cells outcompeted. Therefore, you find one particular group overgrowing the other. And after birth, you find that there is the progenitor cells get reduced. Because of all this, you find that there is either an excess or a decrease in any one lineage, which leads to dysregulation, resulting in CNS disorders such as multiple sclerosis or in tumors such as the glioma. And this is just a list of the cells where they are non-migratory. So in the brain, bone, lung, etc., you can have macrophages which are non-migratory. The blood-brain barrier and the monocytes. The brain is not a very easy site to reach. And how do the monocytes go there? There is a blood-brain barrier. They have to go through the blood vessels. And also, they activate these cells, the T cells, B cells, or the NK cells, resulting in damage. This can happen in inflammation, in autoimmune diseases, or in immunosuppressive disorders such as HIV, in various cancers, and their function results or differs from the resident microglia. What I am seeing over here, this is a Trojan horse in which the soldiers of Troy are residing. It is outside a Greek fort. The Greek people, they opened the fort, they saw the beautiful horse and they pulled it inside the fort. At night, the Trojans won over Greece. That is the story. Similarly, here you find that the organisms will enter the monocytes, travel into the brain, leading to infection and damage. This is a very important diagram, very simple also. I will tell you what exactly to do. There are two types, the M1 or the pro-inflammatory, the M2 or the anti-inflammatory. Forget the substances that they produce. We will try to memorize them later on. There can be secretory markers, there can be surface markers. And these are the markers over here. For each of them, I would like you to kindly go through them. But then coming to the function, these are the list of functions. Cytotoxicity, inflammation, presentation of antigen, permeating the blood-brain barrier, and acute immune response. On the other hand, this is quite helpful and used in wound healing, phagocytosis, inhibition of inflammation, homeostasis, and extracellular matrix protection. So these are two opposite functions carried out by M1 and M2. So whenever there is going to be a decrease in one, the other thing takes over. So this particular diagram is very good. The markers, to that extent, you people can do. Coming back to my definition, it is a schizophrenic cell. So is it a dichotomy or is it a schizophrenic cell? Is it that the same cell is able to perform two different activities? The endothelial cell is another cell which has got a similar function. Coming to the lungs, you find that these are the alveolar macrophages and they are associated with the heart failure cells. These are the pigment-laden macrophages found in the case of a left heart failure. They can be seen in a case of aspiration pneumonia as vacuolated cells. Anthracotic pigment commonly we are finding in the lung. And in any case of pneumonia, towards the organization of the pneumonia, you find that macrophages are involved. So these four conditions alone, you people remember. And the diagram is only for you to follow, not necessary. You have to draw the diagram at each and every step. Thanks to Wikipedia and from own book. So he has to be acknowledged. Otherwise, is very angry. So this is again a similar diagram showing the different types of cells, and they can be originating from the fetal liver or from the bone marrow or from the yolk sac. So with the development of the fetus and the person, you find that there can be a progressive decrease. There will be a disturbance in the milieu interior. Gracias.